Subacromial pain syndrome (SAPS) is a common musculoskeletal condition characterized by pain and discomfort in the shoulder, particularly in the region beneath the acromion, a bony structure on the shoulder blade. It often arises from various underlying issues related to the rotator cuff, bursa, or other structures in the shoulder joint. Understanding the causes, symptoms, diagnosis, and treatment options for SAPS is essential for effective management and recovery. Causes subacromial pain syndrome can result from a variety of factors, including rotator cuff tendinopathy. Degeneration or inflammation of the rotator cuff tendons can lead to pain and reduced shoulder function. This condition is common among athletes or individuals who engage in repetitive overhead activities. Subacromial bursitis. Inflammation of the subacromial bursa, a fluid-filled sac that reduces friction between tissues, can cause pain, especially during shoulder movement. Impingement syndrome. This occurs when the rotator cuff tendons become compressed under the acromion during arm movements, leading to pain and limited range of motion. Shoulder instability. Conditions that affect the stability of the shoulder joint, such as a previous dislocation or ligament laxity, can contribute to SAPS. Age-related changes. As people age, the rotator cuff tendons can become less elastic and more susceptible to injury, leading to conditions like tendinopathy or tears. Acromial bone variants. Certain shapes of the acromion, e.g., hooked or curved, can predispose individuals to impingement and pain. Trauma or injury. Acute injuries, such as falls or direct impacts to the shoulder, can lead to inflammation and pain. Symptoms of subacromial pain syndrome typically include shoulder pain, a dull or sharp pain located on the outer side of the shoulder that may radiate down the arm, pain with movement, discomfort that worsens with overhead activities, lifting, or reaching, limited range of motion, difficulty moving the arm, particularly when raising it above shoulder level, weakness, reduced strength in the shoulder and arm, especially during overhead movements, night pain, pain that may worsen at night, making it difficult to sleep on the affected shoulder. Diagnosis. Diagnosing subacromial pain syndrome involves several steps. Medical history. The healthcare provider will take a thorough history of symptoms, activities, and any previous shoulder injuries. Physical examination. A physical exam will assess shoulder range of motion, strength, and any specific pain during certain movements. Special tests may be performed to evaluate for impingement or rotator cuff injuries. Imaging studies. X-rays can help identify any bony abnormalities or signs of arthritis. MRI magnetic resonance imaging provides detailed images of soft tissues, including the rotator cuff tendons and bursa, to identify any tears or inflammation. Ultrasound may also be used to visualize the rotator cuff and assess for tendinopathy or tears. Treatment for subacromial pain syndrome typically involves a combination of conservative and, in some cases, surgical approaches. Conservative management. Rest. Avoiding activities that exacerbate symptoms is essential for healing. Ice therapy. Applying ice packs to the affected area can help reduce pain and inflammation. Physical therapy. A structured rehabilitation program focusing on strengthening the shoulder muscles, improving flexibility, and restoring range of motion. Non-steroidal anti-inflammatory drugs and SAIDS medications such as ibuprofen or naproxen can help reduce pain and inflammation. Injections. Corticosteroid injections. These may be administered into the subacromial space to reduce inflammation and provide temporary pain relief. Surgical intervention. If conservative treatments fail and symptoms persist, surgical options may be considered, including subacromial decompression, a procedure to remove bone spurs or excess tissue that may be causing impingement. Rotator cuff repair. If a significant tear is present, surgical repair of the rotator cuff may be necessary. Rehabilitation is an essential part of recovery from subacromial pain syndrome. A physical therapist will typically develop a tailored exercise program to strengthen the rotator cuff and shoulder muscles, improve flexibility and range of motion, address any postural issues that may contribute to shoulder problems. Prevention. To prevent subacromial pain syndrome, consider the following strategies. Avoid overhead activities. Reduce repetitive overhead movements, especially without proper warm-up and conditioning. Strengthening exercises. Incorporate exercises to strengthen the shoulder and rotator cuff muscles. Proper technique. Use proper techniques in sports and activities to minimize shoulder strain. Warm-up and stretching. Always warm up before engaging in physical activity and incorporate stretching exercises to maintain flexibility. Conclusion. Subacromial pain syndrome is a common condition that can significantly impact shoulder function and quality of life. Understanding the causes, symptoms, and treatment options is crucial for effective management. If you experience persistent shoulder pain or limitations, consulting with a healthcare provider is essential for an accurate diagnosis and appropriate treatment plan. Early intervention can lead to better outcomes and quicker return to normal activities.